What I mean with something is there was a mass. There was a mass I could feel.
Nice to hear that news that you have a growth,
and
a
I was,
massive,
and do you know what? I tell you what. No, so this thing, when I was walking to my car, I looked at this blood test form, and I was like, "What is it that he wants me to?" I think it was BC25, like something B something, and I was like, "What is that?" So I put in Google. Do you know what that is? It's a cancer check.
Welcome to Consultation Room Podcast.
So today's episode is going to be a very special one. We're going to be sharing a personal experience that I feel is going to be very educative.
It is.
Very insightful. And a lot of people will actually find it very interesting.
Yeah.
So today's episode, we have Trudie sharing a personal story of hers that she's experienced, and it's regarding a very important health topic that I feel affects a lot of people. It's very common and a lot of people can relate to it, but it's not really spoken much about.
That's it.
So please stay tuned because I think this is going to be very enlightening.
Yeah.
Okay. So, Trudie, it's been 3 months now.
Yeah, that's about right. It's been about 3 months.
And how are you feeling in yourself?
I am great. I am getting stronger every day. I am getting better every day.
Yeah.
I am getting back to my usual self. Like, I feel like now I'm pretty much back to my usual self.
Okay.
But it's one of those things that you're constantly like healing. You know, like it's not just straight away you're good. But yeah, no, we're definitely getting somewhere.
Okay.
Yes.
So guys, you're probably wondering what is going on.
What are we talking about?
Yeah. But the reason why I'm asking Trudie how she's feeling, Trudie literally had the major surgery.
I did.
And it's been 3 months now.
It has been 3 months in surgery. I don't want to necessarily tell you yet what the surgery was. I think let's start with it from the beginning, what the story is, So how I ended up here starts from November of last year. Okay. Yeah, so the story starts in November. So November of 2023, I basically was in bed, as you do. Sometimes when you're in bed, you're filling your belly, you've just eaten, right? You've had the shower, you brush your teeth, and you just sort of caressing your belly. Life is good. You're even God, thank God for food. So that's me, right? And I'm just feeling my belly, and then my lower sort of pelvic region, it was just caressing my belly. I felt, hold on, there is something there. I felt something.
Wow.
And I feel more than anything, it's so important that you're familiar with your body.
So true.
It's so important to be familiar with your body, because I even started questioning myself, have I never noticed that there's something there? What I mean with something is there was a mass. There was a mass I could feel, almost like a growth, like a mass, of a growth of something that I could feel there. You could feel almost like the edges of the mass. If I could, if I took my hand around it, I could feel sort of this thing. But then I was like, is this normal? Is this just something I've never really because sometimes you're thinking,
did you feel it grow over time, or
that is November 2023 is the first time I'm realizing this. So I'm like, So I called my boyfriend on video and I said to him, babe, there's something here. I don't know what it is, but there is something down there. Not down there, but around the pelvic region. So he's like, okay, what is it? And I said to him, I feel a growth, a mass of something. And this is, he's not in the medical profession. So for him, first thing is panic. And he was like, okay, what we're doing is we're calling the doctors tomorrow. We need to figure out what is going on. And bearing in mind, I was working away, so I wasn't even home during this time. Hence why I was even calling my boyfriend. So next day, around 9:00, call my doctors, receptionist picks up. She's like, hi, can I help? I'm like, yeah, I hope you can. I'm on an appointment with a doctor. And she's like, okay, what is this about? I was like, I've got a mass in my stomach and I just need a doctor to look at it.
Yeah.
And she's like, all appointments are gone today. So you want to ring back tomorrow at 8:00? As they do,
No.
you know, like literally, if you miss the appointment, and I tell you what, with most doctor surgeries, let's be honest, like they open, I don't know, 8:30, 9:00. You have to literally start ringing at 8 to get an appointment for that day. And if you ring by 8:30, all appointments for the day are gone. So it's like, okay, even if I ring her tomorrow at 8, I'm not guaranteed an appointment. So you're telling me that I have to wait until I can actually get an appointment with the doctors to find out what is going on. I mean, there wasn't any like pain, like shooting pain that can be like, no, this is a matter of like, but still,
anything to do with like growth and mass, like your mind starts to literally
going
wonder, you know,
yeah, what is it? Exactly.
Yeah.
So I said to her, okay, can I just get a telephone appointment with the doctors because this is quite serious? And she's like, let me just have a look. And she looks through her diary. She's like, okay, the doctor will call you in a few hours. 4:00, the doctor calls me and he's like, this doctor is not a usual doctor. So in most GP surgeries, some people have, you know, regular doctors like they see every single time, but I've never sort of ticked that box of, I want this person to be my personal doctor. Anyone available, you know. So I've not actually experienced this guy before, this doctor, before. And he must have been like he was just very to the point, very sharp, there was no, I tell you what, because I've spoken to some of the other doctors in the same practice and they're all like, hello, Trudie, how are you? No, there was no hello, there was no how are you. It was hello, is this Trudie? Yes, okay, how can I help you? You called and you wanted an appointment with us? I was like, yes, I do have a mass in my stomach. He's like, what do you mean? What kind of mass? And I'm like, if I knew that,
you would know what it is.
I know, that's why you're calling them. If I knew that, I wouldn't call you.
Oh my God.
So he's like, but he's a kind of person, you know, like when you had a teacher in school that you were almost scared of. He was that kind of person. And I'm like, I don't want to like say the wrong thing or like
that you get in trouble.
Yeah, literally. So I was like, I don't know what kind of mass it is, but it is a big growth that I can feel. He's like, what do you mean you can feel? I'm like, yeah, I can feel this thing from my skin. And then when I told him that, then he got a bit worried as well. So he goes to me, okay, can you come today by end of day by 6:10? I'm like, I mean, this is 4:00. He's telling me to get there in 2 hours. I'm not even home. I'm working away. And I wasn't going to go home for another week. And I was like, I can't come in today, but can I get an appointment for maybe next week, Monday? Because I think at that point it was like a Tuesday.
Okay.
And he was like, for that, you've got to ring either on Friday or on the Monday. I was like, so I can't even book an appointment in advance? Wow. He's like, no, sorry, you can't book in advance. If you can't come today, I can't help you. I was like, okay.
Oh my goodness.
Yeah. I was like, okay. I mean, you know, it is what it is. So I tried to just not worry too much about it. Okay. I was not even eating anymore at this point. I tell you what.
Oh, no.
It's because I'm thinking,
you were worried.
like, what if food is going to make this worse? Like, it's going to maybe like push, you know, this, whatever this is.
Were you in pain? Anything?
No, like I was not, that's the thing. I was not in pain as such. Okay. But I think now psychologically I'm in pain because I'm thinking, what is going on with me? Yeah. So anyway, on Friday, I called the doctor's GP and they're like, so for Monday appointments, you've got to ring on Monday. And I'm like, great. At this point, I'm thinking, we're going to go like this. It'll be like 2030 when people are barring me and they're like, oh, yeah, she had this and that and she, you know, got diagnosed late and sorry, you know. At that point, you're thinking everything, you know. So I am literally like, okay, I'm just going to go ahead and call the doctors on Monday. Yeah. So on Monday, I had a breakfast appointment with my a breakfast date with my nephew, right? So we were meant to go for breakfast and I was supposed to walk into school. So we did our breakfast and then I was walking into school. And once we were walking, I was on the phone to my doctor's surgery. Okay. And as I said, so he leaves for school at 8:15 and that's when I was ringing the doctors. So I knew I'll probably, to be honest, when I called, I was like 11th on the queue already. So I was like, I'm just going to put in loudspeaker so I can still talk to my nephew on the way to school. And by the time, you know, they answer the phone or I'm first in the queue, I'm now talking to someone. he'll be in school already. So drop him in school. I'm still like, at this point, I'm like second in the queue, and I'm walking back to my sister's. And as I was walking back, you know, I spoke to someone, and they were like, oh, yeah, so you want a telephone appointment today? I was like, yes, please. They said, okay, the doctor will call you in about 2 hours. I was like, that's fine. Because I'm thinking, if he tells me anything, I'm home now, I can go. Yeah. So literally it's like a 10-minute walk to my sister's. So 5 minutes later, the same receptionist calls me, and they're like, actually, I've just spoken to the doctors, and they want to see you today in the next hour. And I'm thinking, okay, yeah. At this point, I'm thinking, yeah, wherever there's available, I'm taking it. And I was like, okay, yeah, I'll be there. So I have to get to my sister, get my car, and my sister lives literally about 40 minutes from my doctor's, and try to get to my doctor's. Anyway, so I'm racing, and I get to my doctor's, and I got there, and literally first thing I said to him is, sorry, I just need to use your bathroom because I know you might be palpitating me, feeling my stomach, and that already is gonna make me want to pee. So I literally ran in the toilet, and did my business, came back, and so he was a male doctor. He had a chaperone with him, and he was like, okay, so what is going on? I said to him, well, I've just very recently noticed this mass in my stomach. And I was like, okay. And he was like, okay, that's fine. We'll have a look. So he went through some questions with me, like, when was your last period, all of these things. Went through that with him. And then he said, okay, I need you to stand up and cough.
Okay.
I have no idea what he was trying, and at this point,
what is that?
I have no idea. So I'm like, he's like, I'm holding my t-shirt up a little bit so he can like feel, what could be going on. And I'm coughing. And he's like, okay, again.
What is that? Do you know what that reminds me of?
What?
Like, when they go to the prison and they
Yes.
like, oh, sorry, I know.
Yes. They say, sir, can you cough? Yeah, that's exactly it.
Oh my goodness. Okay.
And then he was like, He's not saying anything. He's basically telling me what to do. And then he says, okay, now I'm just going to do like a proper check. If you lay on the table, and then I can do, whatever I need to do, like palpitate properly. And I'm like, okay, of course. So I lie down. I mean, I'm not naked, let's be honest, to start with, yeah? I'm not naked. So I'm there with I was wearing trousers, thank God, not a dress, because then you have to pull your dress over. I was wearing trousers, and he just told me to just sort of like push it down a little bit, because it's the pelvic region that, the mass was. And so he starts feeling the abdomen, that area. And then all he was saying was, I'm sorry, that is
really,
already.
That's all.
I'm thinking, that is not what I need. But he's like, okay, okay, that's fine. You can get up now, whatever, and just dress up, and if you just take a seat, and we'll just quickly have a chat. I'm like, at that point, I tell you what, my heart was pounding.
What's going through your head?
I was thinking,
honestly, what were
I
you
thought
thinking?
there's a tumor.
Yeah, I would be thinking the same.
There's a tumor in my abdomen, and the way he's going, okay. So he sits, we sit down. He goes, okay, yes, there's a growth, there's a mass in your abdomen, and I think he could see my face as soon as he said that, and he said, wants to hear that. And he was, to be fair, he was actually really good. Like every time now I go to them, I try to find out if I can see him. He was very reassuring, very good. He said to me, but look, don't panic. It doesn't mean anything. It could mean that maybe there's just a tiny little growth there. It could mean that maybe it's a cyst. He said it could be a cyst, but the only sure way of finding out is an ultrasound. I'm like, okay, reassuring. And then he says, but what we're going to do is we're going to do a blood test as well, just to make sure that your hormones are okay and everything. I'm like, yeah, of course, yeah. I mean, yeah, I want a blood test to check my hormones. Why not? So he gives me the blood test form. I take it with me, and I get in my car, and I call my boyfriend. And I think the minute I heard his voice, I started crying. Honestly, I was bawling. And he's like, oh my God, babe, what is it? Calm down. And I'm thinking,
nobody wants to hear that news that
you
you
know,
have a growth,
and
like,
I was,
massive,
and do you know what? I tell you what, no. So this thing, when I was walking to my car, I looked at this blood test form, and I was like, what is it that he wants me to? I think it was BC25, like something B something. And I was like, what is that? So I put in Google. Do you know what that is? It's a cancer check.
I thought
So I was like, I think so. That's when it hit me. Like, he was, of course, being reassuring because he also was in a position of, okay, this could be life changing. Yeah. So he wanted me to just be very calm. And so telling me, oh, it's just a check my home and whatever. It's just a way to calm me. And I appreciate that.
Basically come up to a diagnosis, so he needs to do all of these
checks. Yeah. And I appreciate the fact that he was not trying to scare me without knowing what it was. But just me and my nosy self. No, my nosy self had to go Google wherever this check was. And I found out that he was checking for cancer. Anyway, so I got in my car and I literally come up and I was crying. I was like, hey, I don't want to die. I don't want to die. He's like, it doesn't even mean that. But, you know, the association, you know, there's that fear as well. So anyway, he was just very much like, we've got this. I've got you. I have to say, like, my boyfriend was so supportive. The whole process, he was so supportive. And it was just nice to know that, okay, like, it's not a matter of, okay, so what did you do wrong? You know, kind of thing. Because sometimes, let's be honest, like, sometimes you can, like, how could that have happened? I don't know. But he was just very much, look, whatever the outcome, we've got this. I've got you. You know, we're gonna work through this. We're gonna get you to a healthy state. And I was like, okay, I needed that. So my dad used to work in a hospital, right? That was close to my GP surgery. And so what happens is, whenever I need a blood test, I call my dad. And I'm like, Dad, I need connections because I need a blood test today. But you know, when you get a blood test, when you got form for blood, you have to wait a few days, or you have to try and
it takes a while.
Exactly. So I needed something straight away. So I called my dad. I was like, Dad, I need a blood test. Is there any way, like, you know, you know anyone? And also I needed to book both a blood test and an ultrasound. I said, and even at the hospital, do you know anyone anyone who has appointments for ultrasound? It's like, why do you need that? I'm like, I noticed like a tiny little, because I'm trying not to scare my dad. I'm not trying not to scare anyone. So I said to him, I just noticed a tiny little growth, went to my doctor's and he gave me a blood test form just to get, like, you know, my bloods checked, make sure everything's okay. And also just to get an ultrasound, just to make sure everything's okay. He's like, let me see if there's anyone I can get in touch with. And so I'll wait there for about 10 minutes. And at that point, I'm just thinking, oh God, like, this is just terrible. But my dad doesn't get back to me, unfortunately. So I said, you know what, I'm going home. And the thing is, I was going away that day. I was going to Germany that day. So I was like, okay, I need to really get home and just pack my things and go to the airport. So anyway, my dad didn't tell me if he found someone. So I called him. I was like, Dad, don't worry. If you're looking for someone, it's okay. I've left. And I left, right? And honestly, my partner was so supportive the whole time. My boyfriend was so good. Like, he would not let me carry things. He's like, you're not well. I'm like, sometimes when you're not well, to be fair, you appreciate the people who are I won't lie. But the thing is, I think my dad must have told my sister about this whole ordeal. Because now my sister calls me like 3 days later. She's like, oh gosh, Trudie, I had a dream. I'm like, what dream did you have? She's like, that you were having a baby. And I'm like, huh? Okay, that's interesting. And I could hear even singing to my little nephew, oh, you're gonna have a cousin. And I'm thinking, oh my God, this girl. Oh my God, I bet you were pregnant. I think my dad must have told her. And then the whole ultrasound blood test, they must have said, she's going to. So the whole time I'm like, okay. And I'm thinking, if you knew, because they checked all of that. No, that was not the case. But I'm like, okay, I'm thinking if that's the story they're going to go with, I'll let them, you know. Anyway, I had to go for private ultrasound because it was taking a bit longer with the NHS. And I was like, I cannot wait. I need to know what's going on. So I had my ultrasound. I don't know if you know, what am I saying? You have had ultrasounds. Oh my God. Yes, of course. But you're supposed to drink loads of water.
Okay.
Oh, no, you're not supposed.
with-
No, you're not supposed to drink water. No, you're not. Hold on, I'm confused.
I don't.
No, you're not supposed to eat. With a normal ultrasound, that's not. Okay, maybe mine is a little different to yours, but because it was not really a pregnancy one. I was not supposed to eat. I could drink. I could drink up to, I think, 2 hours before the ultrasound, something along those lines, right? So when I got there, literally I could feel my belly. I could feel all the pressure. And every time he was doing that with the machine, honestly, I could feel, I was like, oh. Anyway, so the guy did it, the ultrasound, and he goes, oh, bad news. I was like, okay, go on. You've got fibroids. Yeah, I was like, and I tell you what though, I smiled.
Yeah.
I was like, oh my God.
I think I'll be relieved.
I smiled, and he was like, what is wrong with you? I was like, you have no idea.
Listen, me and you both.
You know, I was so
I'm like, thank God.
relieved that it was fibroids and not a tumor.
Yeah, honestly.
You know, he said, you've got fibroids. And I smiled, but then I realized, shit, I've got fibroids. Okay.
Wow.
This is still like
still
a game changer.
Yeah.
So I was like, and then he goes, and I said, and I actually asked him, I was like, what, like, how big are they? He was like, I'm not going to lie to you. They're quite big. I was like, okay. So he goes, one of them is about 6 centimeters. The other one is about 8 centimeters. I was like, okay, I've got fibroids. Okay. He's like, what's your bladder been like? Like, what's your bladder habits? And I was like, well, I mean, I don't really drink much water because the minute I do, I have to go to the bathroom. He's like, yeah, that's what happens when you have fibroids. And that's when I started putting pieces together. Yeah, like my bladder is literally, you know, when we had the episode and I said my bladder is small. Yeah. That is it.
The water episode.
Exactly, because I can't retain water. You know, it goes in, goes out. And actually, when we were recording that evening is the day I found out I had fibroids. Not the same episode. I think it was a different episode. But I think I told you maybe a day after. Because I was like, I don't want to tell you before this episode and then it will be weird. I was already weirded with it. And it was like, okay, the next day I think I told you, I was like, okay, I've gone to, had some tests done and I've got fibroids. Anyway, so it was a matter of, okay, I need to, so I sent this private whatever to my GPs and then I had to be referred to a gynae. And so what that means is I had to go through a gynae to find out what was the next step. Exactly. And I think that is quite scary when you're having to go to a gynae already. It's like, okay, that means something's wrong with your labia area.
So did they explore different treatments with you, because we know you had a major surgery, but did they explore different treatments with you before getting to the surgery?
They did. My gynae he was so wonderful. And the thing is, with fibroids, it affects mainly, like I would say a good percentage, maybe even 80% of people with fibroids are people of Black descent. So it was, I don't want to sound weird, but it was important for me to have a gynae who was of my ethnicity, because they would almost know it from a first-hand experience, if you know what I mean. So my gynae was Black, which was good for me, and I think it's also comforting. There's that comfort of, okay, there's nothing taboo about you. He was very much like, okay, yeah, I've dealt with a few of these cases, like very much, okay, you know what, it's not like something so unique to you. It's something that can happen. That's right. So yes, he did explore a few treatment options. So there was the option of what he said to me is there is different options, but he told me that the best option for my case would be surgery. Part of it was because of the size. And because it was more than one. So they were very big fibroids. So they were almost the size of my bladder. So it's 2 fibroids, the size of my bladder, to maybe even go go through the laparoscopic way, which is sort of extraction through the vagina or extraction through like different tiny holes, would not have served me any purpose, because that was not really an option for my kind of fibroids. And also sometimes they give you the option of contraception, contraceptive pills that can that can maybe reduce estrogen levels, which will technically maybe reduce the or slow down the regrowth. If they're very small, you can kind of like get on with life with them not, of course, increasing. So there was that option, but I think for me those were not really options that were going to do me any good. Exactly.
So how did you feel when surgery was the best option for you? Like, how did you feel?
Overwhelmed. Absolutely. Like, I can't even lie about that. It is an overwhelming feeling when you have to go through surgery, especially if you've never been through any surgery. I've never been put under for any reason.
Same.
When people go even to like for these minor surgeries, like the 30 minutes, and they're like
colonoscopy or something, like they put you under anesthesia.
And then you're like, you've experienced that. I have never.
Okay.
I don't drink for so many reasons. One of them being because I like to be in control. I need to know I'm awake. So to think that this could be a feeling of no control, and it's like something drastic happening, overwhelmed 100%. But I think it was also assuring that it's something that can be done to help, remove them, to help get rid of them, because we know that fibroids can affect a lot of things. So knowing that there's something that can be done so that it doesn't get there was also like a relief. Yeah.
So you had your surgery like months after actually being diagnosed that you had fibroids. Yeah. So during that time, did you experience like any symptoms? And did the fibroids affect like your daily life or physically?
The thing is, the fibroids were actually affecting my daily life already, but I didn't know. Okay. And sometimes I said before, it's so important to know your body.
Yes.
It is so important. Like, I can't emphasize that enough, because a lot of times we put it down to age, to, I don't know, changes in the body. When something happens, you're like, I think that's just my body changing. Yeah. Or like, I think I'm just getting a bit older.
Honestly, I say that all the time.
Exactly. And that was exactly what happened with me. I always say, especially since I turned 30, I was like, I think since turning 30, it's downhill. The body is not the same. Like, I can't, I'll be honest, like in my 20s, I didn't have any health scares or any health issues as such. So now, in my 30s, and it's like, okay, wait, hold on, that's definitely age. Yeah. So I tell you what I mean by it, I was already having symptoms, or it was already affecting my life. So for starters, a normal period, like, what is your normal period? How many days? Okay, 5 days. Yeah. And is it like...
Usually, like, I bleed a lot, like, first 3 days, and then I have, like, a major pain, like, during the first three days, and then in the middle of the week, like, in the middle of the 5 days, I get really sharp pain. Okay. Usually, that's just mine. That means there's a big clot coming.
Okay. Really? Okay. Yeah. And how often do you have to... Okay, let's say, we're going to be very honest and very candid here. So when it comes to, say, sanitary towels, how often do you change them?
So, like, during the day, I would say probably like 3 times.
Okay, and that is enough.
That is enough for me, because, like, in the morning, during lunchtime, then
evening,
before
before bed, and then that's it. Okay, see,
how
now
many did you use to go
that
through?
Exactly, and that's what I mean. Knowing your body is so important. So I think since sort of like, and I don't want to say anything to do with age, but I think in my 30s, like, I'd say maybe in the last sort of like 3-4 years, what I noticed is my periods were heavier.
Okay.
My periods were heavier. My periods were very painful. Now, I was having a period for at least 7 days to 10 days.
Wow.
But to me, again, it was age. I'm thinking, God, God damn, so age is like...
It never used to be like that. But then in your 30s...
Yeah. In my 20s, exactly like you, like, you know, once every, like, you know, few hours, like I would wear a pad, 5 hours later, I can change and I'm fine. But now, during the last few years, I'm not joking. I'm not joking when I say this, but it got to a point I was changing my pad every hour.
What?
Yes. And sometimes an hour was not enough. And I could feel a need to change a pad. I was like,
Oh my goodness.
And I thought,
how much were you bleeding?
Exactly. I was bleeding quite a bit. And even got to a point that I was having to wear, we're going to be very candid, guys. So please, if you're not here for that, I beg you, please just bear with us. But I would have to wear like a tampon and a sanitary towel at the same time.
Wow.
And at least that way I was able to have that for maybe 2 hours, like 2 hours to 2.5. But otherwise, if I wore, say, just a pad, every hour I'd have to pretty much change it, especially for not for the full sort of like 7 days, but for the first, I'd say maybe 3-4 days.
Okay.
After that, it would be now normal-ish, because then I would have to change it maybe every 3 hours for the last sort of 3 days. But I tell you what, the first 2 days, the pain, when my gynae tried, so when I was going through some of these like questions with my gynae, you know, he asked me, so how's your period normally? And I said to him, this was the exact words I said to him, because this is exactly how I referred to my period. I said my periods were sent from hell. Wow. Because the first 2 days was so bad. The pain is not, I had to call in sick a few times. Not necessarily calling sick, but even, to be fair, I'm not one to call in sick, but I was mostly going to be a bit late because I just needed to, because the pain, I could not get out of bed. It was so bad. Or like, it's the kind of pain, like the first day especially, like if say I start my period at night, 3 a.m, I'd be up and I'd stay up until 8 because of the pain. So the pain was really bad. But again, put down to 8 and I was like, they should have warned us. They should. I used to say they should have warned us. If this was it, I don't want it. But again, also, I think that goes to show, as much as we are, you know, we're health experts, we're very good at sort of assessing and analyzing other people's. But when it comes to our own, we're dismissive.
It's like we're babies. We don't know what's going
on. And I'm like, now thinking back, I'm like, Trudie, you're a pharmacist. I'm sorry, but if there's a change like that, you should have gone to your doctors. Yeah. But for me, I'm thinking, because I tell you why, because it happened gradually. Like it started with like getting worse, got really, really bad. Okay. And so I thought, wow, by the time I'm 40, I won't have any blood in my body. And what that meant, of course, is I was losing quite a lot of blood. So I was anemic. Yeah. So I was anemic. I've always been anemic, but I was very, very severely anemic. So, as I said, it was already affecting life, but I just didn't put it down to it. And as I said, as well, when I went to see my GPs, I said to him, I need to go pee straight away, because as I said, it's literally, it was, so one of the fibroids was literally right next to my bladder. So when the guy saw it, he's like, whoa, that is literally pushing your bladder. I'm like, okay, that explains it. Yeah. Because I could drink something and straight away, like if there's not toilet, we'll be dancing, because I need to, it goes right through.
Oh my goodness.
Yeah, so it was already affecting life. Yeah. It's just one of those things that it can happen with fibroids. Yeah. Now, a lot of people have other symptoms. Some people have like, they notice like the stomachs get quite big because of the size. But I was fortunate, even though I could feel my fibroids, my abdomen didn't get too big. Like I could notice like, okay, I mean, there was, you notice some things. But you notice some things normally that, okay, it's not there, but there's something there, you know. But it wasn't like, if anyone knew me, if I didn't tell you, you would never have known. No. Exactly. Yeah. Because it wasn't really visible. Obvious, no. Exactly. It wasn't at all. But what was visible was in the inside. Like the inside, I was definitely going through things. But so that's how my journey started with the gynae. Yes, and then he says, we're going to have surgery and we're going to pick the date for surgery. And we pick the date for surgery. And because of the size of my fibroids, so fibroids surgery can be they can be quite different. You know, you can have, as I said, laparoscopic, where they just sort of like use a small hole and they kind of get rid of them. or they can have like an open myomectomy, which is what I had.
Okay. So walk us through your surgery.
Okay, I will do that.
I want to know, because I wouldn't get scared of
yes. So as I said, this was my very first surgery, and so day of surgery. So you go for pre-assessment, and they go through all kinds of things with you, in terms of like what you need to look forward to or not look forward to, basically, and then you go in for your surgery. So I went in for my surgery. I was one of the first people that day, but I ended up being one of the last people. I think maybe because they thought that my surgery might take a little bit longer. So if they did that in the beginning, then everyone else would just be delayed. So I was the last surgery of the day, and so basically went into. I don't know if you've actually ever been to a theatre room.
Yes, I have. Yeah, but it's just to observe.
To observe, not to do. So that's the thing. I think when you're there with a gown, it kind of changes the game, because you're thinking, "Wow, I'm actually really sick." Yeah. So I was wheeled into the theatre room, and so prior to get to the theatre room, we just stopped before the theatre room. There was, I think, the room where you get all your, the cannulas and all of that, right? And they were all very nice. They're like, "Oh, so Trudie, how are you? What do you do?" "Yeah, I'm pharmacist." "Oh, wow, yeah, no. So how's it going here?" And then next thing I'm in the theatre, and then I've got all these drugs inserted, inside through the cannula, and they're like, "Okay, so you will feel this one," and literally, bum, done. Woke up, and I was in recovery room, and I'm like, okay, this is weird, but I felt so cold. I felt so cold.
Drips that we're putting in.
Yeah, but I was so cold, and the lady's like, "Trudie, wake up." I can't wake up. And I'm like, okay, this is crazy. Anyway, so I had the surgery, and as I said, it is an open myomectomy, so it is very similar to a C-section cut. So you're cut around the same area that anyone with a C-section would get the cut. Now, my surgeon was actually the gynae who I seen before. Okay. He was also my surgeon.
Oh, wow.
Which was brilliant. So he walked in, I was like, "Oh, hi." So it was very nice to have a familiar face, and to just see that the person who had been with you through the journey was seeing you through the end. And he's very good in like his cuts. Okay. So I tell you what, we're going very deep here. But normally the bikini line is ideal for like a C-section, right? Some people get a little bit up. Yeah. Some people getting right on the line. I don't know how he done it, but it is so low that if you don't ever know that I had surgery, you won't know that. Yeah. Really? Yeah. There is a scar, of course, but it is not visible when I'm wearing my knickers. Good. So yeah, that was really good. So I was in hospital for 2 days. And that experience in hospital, honestly, night one, not mine. No, I've realized I don't ever want to be ill. Like I'm gonna start cycling, swimming, running, doing the whole shebang because I don't want nothing else. Yeah. But yeah, they were really, really good, and I was discharged with some meds. And it was just a matter of, you just have the dressing, the waterproof dressing on the cat, just because, you don't want it, getting wet or getting infected or anything like that. Yeah. And I went home, and, went home walking like a penguin. And Steph was actually so lovely because I was discharged on a Monday, and I think he came to see me on a Tuesday, and that was so sweet. Like, can I just say, sometimes I think your friends, you realize who your friends are when you go through some of these situations. So thank you so much. No. That was very nice to see you.
I got you, man.
But I didn't want you to see me walking like that.
She literally was waddling.
I know we're laughing about it, but it was
I did feel so
it was painful.
Like, oh, bless.
It was so painful. I wouldn't lie. Night one was the worst because of the cut. It is on the abdomen, and you don't realize how much muscle you use and need just to do everyday things, like sitting on the toilet, sitting on a chair, laying on the bed. Yeah, getting in bed was the worst. Oh my God! But by the grace of God, we made it through. Yeah. And so normally within sort of like, you take about 6 to 8 weeks
to recover.
Yeah, off work, just to recover, which is what I did. Okay. And you came to see me a few of those times.
Trudie was eager to literally get on her feet. I'm like, this girl, that's why when she was waddling, I was laughing at her because she's usually always like on the go.
I
and
am.
stuff. So she was itching. Like she wanted that recovery process
Yes.
to be over quickly. I'm
Oh.
like, Trudie, let nature work its course.
I had actually said to you, like, oh, I'll see you next week, like after the week after my surgery. And I was like, actually, no, maybe not.
It humbled you.
Yes, it did humble me.
Yes.
It did humble me.
Yeah.
But honestly, the recovery is quite tough, I won't lie.
Yeah.
Because, I mean, the first week, honestly, is very, very tough because you're struggling to do a lot of things.
Yeah.
But on top of that, you're also almost relearning to do some of these things. You know, some things that you would do on an everyday basis, it's not really something that you do anymore. And it was great, but it was tough.
And so, now that you've had your surgery, you've recovered.
Yes.
How has your life changed since having the surgery? Like the things that you were experiencing, like the heavy bleeds and things, the pain. Has it changed, or how has it been? Has it made your life better?
Well, I'll be honest here. Not yet.
Wow.
Yes. So, well, I did see. So I had my after the 8 weeks, I had an appointment with my gynae, same guy, lovely. And we were talking through some of the things. And he said, how has your period been? Now, bearing in mind, I have my period like every 21 days. You know, some people have 28 days, some people have 35. I'm like, wow. I'm going through, I'm literally making money for always. Like, they need to sponsor me because I am out there spending my money. So at that point, I'd actually already had 2 of my periods. And he was like, how was your period? And I was like, I won't lie, very heavy. And he was like, expected. Because what he said is the first of couple of times you have your period, it will be very heavy because your uterus is still trying to heal, which is, I understand that. Yes. You know, when your uterus is trying to heal, of course, your periods will be a little bit heavy, and that is normal. It's not really unexpected, but again, it's been 3 months now. But I won't lie, my last period was still very heavy. So I don't know if my uterus is just taking a little time to heal. And of course, as I said, I'm recovering. I'm not quite there, but I'm recovered. I'm a recovered recovery. You know, I'm recovering, but I am recovered. So there's no pain in like the heart, you know, but there is a few things that are still ongoing issues. But honestly, if that means, now bearing in mind that fibroids can actually prevent you from getting pregnant, or they can maybe if say you were to get pregnant, these fibroids, that can give you a lot of issues that can, you know, come with a lot of issues. So just knowing that maybe I don't have to go through that calms me.
I think you've answered my question. I was literally,
okay.
It's about thank you, but because you know some people have that mindset that will like once you have fibroids, it's actually going to affect like fertility issues and stuff. Did you have that like anxiety or fears like when they told you?
When they did, yes.
How was the relief after?
And I think you know, like when I said I was very overwhelmed that I was having surgery, but I was relieved that it was going to be a solution to something. Yes. You know, it was going to be a solution to a lot of things, let's be honest. That gave me relief, right? So one of them is the fact that if, say, I didn't ever go to my doctors and say I was trying for baby and I either could not get pregnant or I was having miscarriages, it could have been because of this. You know, no one ever wants to go through that. Yeah. So it is good to know that I was able to find a solution before it became a problem. Fantastic. Exactly.
Oh, great.
Yeah.
So what would you advise someone that's dealing with like fibroids right now?
Okay, so fibroids, unfortunately, is something that affects so many of us. Now, you will probably know someone who has fibroids, someone who knows someone who's having fibroids. Maybe someone in your family has fibroids, maybe you are having fibroids. So it's something that is very common. And especially, as we said, in women of color, so Black women especially, we have, a lot of us do suffer with fibroids. But what advice I'd give to you is have that conversation with your gynae. There is a lot of options out there. And also, fibroids does not mean that, your life has stopped or your life can't go on. It just means that you have some challenges getting through everyday life, but that's not the end of it. So what I would advise is, if you have fibroids, there is treatment out there. So you have that conversation with your gynae, discuss on whatever potential treatment options there is available, and get that treatment, because it can get in the way of life, and it does get in the way of life, but it doesn't mean that is it. There is a solution. So 100%, you're not alone. We're a community here, and there's gonna be a solution for fibroids. I mean, it is something that, to be fair, should be discussed, should be talked about a bit more. People need to have these conversations.
That's right.
Because I didn't even know how prominent it was in the Black community until I think I had it, and then I started doing my research, and I'm like, hold on, no, actually that explains why now all these family members have had it.
Honestly, I know so many people, like aunties, cousins, like so many people that have it.
Exactly.
And it doesn't get talked a lot.
It doesn't even get talked about, let's be honest.
It
doesn't,
not at all.
Like, until I suppose someone who has it, you're thinking, what is that again?
Yeah.
Then you don't actually even know what it is. So it is not talked about. It is not understood. There's not enough research that's done on fibroids, and I think that needs to change.
Absolutely.
Yeah.
Absolutely. So I really do appreciate you sharing your experience. Honestly, I feel it's been very insightful for me, like, and actually seeing you go really deep into like this health topic, I think it's been really inspiring.
That's good.
Very, very inspiring. And as you said, it's so prominent in our Black communities. Like, a lot of like young girls, women are really going through this fibroids, and we really need to touch on it, like especially ways in like how people can be diagnosed or find out that they have fibroids. I think that is key, because sometimes people are diagnosed really late. So it's important that we have another discussion with like a professional, like an expert in this area. So
and I think also part of this, having this discussion with maybe an expert, is to also understand what really causes it, because we don't know much about it, but we would love that insight on, like if you ask me what caused it, Trudie, I don't know. I have no idea.
Do you know what I want to know? Why it affects a lot of Black people?
Well, I think part of it, so I did ask this to my gynae, and what he says is it's all to do with estrogen levels. So because, and I know we say sometimes, and I think when I found out about this, it kind of humbled me in different ways. When it comes to, say, blood pressure medication, there is normally fast-line treatment for Black people, fast-line treatment for Caucasians, because we forget that as much as we're one people, we are human race, we're all very different. Our DNAs are different, our makeup is different. So it's exactly the same thing. Black women are also have got a different makeup to, say, Caucasian women, to other different ethnicities. And so what happens with Black women, we produce a little bit more estrogen. And I think that is part of what causes fibroids. But I think we should discuss this in detail with a gynae, because how and why, right? Yes.
So guys, stay tuned. We have something special planned with an expert, because we really need to delve deeper than we have today. Today was just Trudie sharing her personal experience with us, so that people can actually get to know. And
we did say we're gonna be personal, didn't we? We said we're gonna be very personal in this season. So it's easy for us to talk about something, but it's easy for someone to take it if it's coming from us, from personal experiences. And we also have a very special guest in our next episode, who is one of the advocates for fibroids, and you probably know her. She is big on social media, so that is also something I'm excited about, to know her story. You might have seen her on telly, so guys, stay tuned.
Thank you so much, Trudie.
No worries. Thank you.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week. Stay safe, stay healthy, and stay blessed.